When I'm up through the night, I can't turn down the noise, say all the words out of my mind.
Hello friends, welcome back to the Interventionist channel. Thank you for your humble support. And we have crossed the 1K landmark in the subscriptions. So this is a small thank you video for those who had actually supported the channel so far. And today's topic is a very simple one and it's a very short one. I'm actually going to discuss about radiology in general. There have been questions asked by some of our undergraduate students regarding radiology department. So I myself asked the same question: what do you know about ourselves? What do you know about radiology in general? So I decided to make a small short presentation of it. So today's topic will be a brief one. It is about introduction in radiology. Hi, once again, this is Dr. Arif Khan. I'm the interventionist in YouTube channel. Basically, radiology has two prongs. That is radio diagnosis and radiotherapy. And of course, nuclear medicine also comes in this category because there also we use radiation for imaging. And then we all these things started in the initial period where some physicist by the name of Konrad Röntgen actually was trying to discover radioactive or a substance, and he was trying to measure something, and accidentally his hand, which was placed on a photographic plate, got imprinted on it. So this is the first ever X-ray of a human being, which was taken in the 1895. And he is a physicist. He was not a doctor. He is a physicist who accidentally discovered X-rays. So, going into detail, radiodiagnosis. As such, radiodiagnosis we can again classify it into two branches. One are the diagnostic radiology, the other one is interventional radiology. So diagnostic radiology essentially started with the invention of X-rays. Everything essentially started with the invention of X-rays, and it took almost another more than 5 decades for the next modality to come. So if you say the chronological order, in 1895 the first X-ray was discovered by Röntgen. After that, it took almost more than 5 decades to for the second modality to be properly researched and developed. And then on the same year, we had a radionuclide imaging making its breakthrough as well. So all other modalities are of recent origin, and in between 1972 and to today, 2020, we have gone through so many generation of CT machines, and the radiation doses which is now in question regarding various evaluations, especially during the COVID period. We'll discuss those things in detail in later images. Then came the MRI almost on 1 year back, 1 year after the discovery of the CTs, and then we started doing DSA using the same X-ray technology on 1977 onwards. So the important thing to note is the radiology as a field in modern medicine started with the discovery of X-rays. So diagnostic radiology, our tools at disposal are X-rays and related modalities, which include CT, DSA, mammogram, etc. Then we have ultrasound, MRI, PET-CT. So ultrasound basically uses the propagation of sound waves and its response to matter for radiological evaluation. Then we have MRI. MRI uses again a technology called nuclear magnetic resonance, which is actually it's a huge topic in itself. Then we have a gray area, PET-CT. So PET-CT, even now there is a strong debate going between the nuclear medicine people and ourselves whether it is a part of radiodiagnosis or it is a part of nuclear medicine. Actually, it is a symbiotic relationship, as the name itself suggests. The PET part, where we give the radionuclide FDG, and the CT part we do the morphologic imaging, and combining both morphologic imaging and the nuclear imaging, especially in good centers. We do both by both the nuclear medicine and the radiology doctor in charge. So PET-CT is a combined effort, and in our hospital we do our reporting like that. So then we have the therapeutic modalities, which is the interventional radiology. So basically, therapeutic modalities are all developed later, especially the X-ray related therapeutic modalities like our DSA. These things are used for therapeutic modalities. So basically in radiology as such, other than the cardiac interventions, there is neurovascular intervention done by radiologists, which includes procedures like clot retrieval, coiling, embolization, etc. And then we have other type of interventions like gastrointestinal interventions, like catheter or pigtail interventions, stenting, drainage, which are like PTBD and BTC. PTBD stands for percutaneous transhepatic biliary drainage, and PTC transhepatic catheter insertion. So, and stenting also. So other than that, there are so many other procedures we do as a diagnostic intervention like biopsies. So these all things require radio diagnosis. That's why we use either one of these modalities to do the diagnostic interventions. USG guided biopsies, CT guided biopsies, USG guided pigtail insertion, CT guided pigtail insertion, etc. etc. So the list goes on. So again, back to this slide. So coming to the most important part of today's discussion, for in a sense of a general practitioner or even in some specialists, these doubts are always there. So I choose today to answer those questions. So first is usage of ionizing radiations. So not every investigation which we do in radiology has ionizing radiations. So X-rays in general have ionizing effects. So any procedure which uses X-rays for a diagnostic purpose has ionizing problems. That means it has radiation. So everywhere in the radiology department is irradiated. That is another query by most of the people who come to radiology. They ask. So no, there are places where you should be, where there are places you can be, and there are places where you shouldn't be. So we have divided like that in our department. So okay. So we have taken adequate preparations for protection for both the public and staff during a particular ionizing or radiation investigation. Like you are doing an X-ray, the X-ray room, only the person who is getting exposed will be there. Even the staff will be staying behind a lead wall or a lead window. So similarly, USG evaluation is totally radiation safe. It does not have any radiation at all. So that's why we use USG as evaluation modality even for pregnant ladies. And MRI, even though it doesn't have any radiation, MRI has its own hazards. Like MRI has interaction with ferromagnetic materials, that is magnetization property is there. So if a person comes to a department who wants an MRI and who has a metallic implant on his body, we have to make sure that he or she doesn't have a ferromagnetic substance implant in her body. Similarly, the same thing goes for cardiac pacemakers, which has to be switched off before doing the procedure. And one important thing is MRI do have a problem with radio frequency waves used for imaging, like which can cause a mild heating up during the evaluation. A 45-minute evaluation of MRI will have a very less dosage than a 45-minute phone talk with some of your friends using your mobile phone, using the modern 4G, 3G, and the upcoming 5G technology will be having more radiation than MRI altogether. So CTs and cancer, the most hottest topic nowadays because of the increased number of CT evaluations done in the recent time due to COVID-19, and the numbers have come up because X-rays are not sufficient anymore. we need a basic evaluation CT done for most cases and followed up by an advanced imaging for a follow-up. So minimum 1 to 2 CTs, maybe more than that, has to be taken for patients over a period of 3 to 4 months, like that. So this has created a concern whether CTs can cause cancer or not. Actually, the answer is modern day CTs are, unlike older day CTs, have very less radiation dose. Because of the advent of modern day technologies, we are using very less number of X-ray photons to image the body, and the number of X-ray photons is the one thing which contributes to the radiation dose. So the low energy X-ray photons are completely removed, or it is filtered off in most of the CT machines, and we get a good image within a short period of time. And when you compare the CT machine which was initially used in the 1980s, the modern day machines which was used around in this 21st century, there is at least 75% reduction in the total radiation exposure of X-rays. Earlier they used to say that one CT is almost equivalent to 150 X-rays. That was in a perspective with that generation CTs. So in current generation CTs and X-rays also, it is almost similar, about 100 times. But the thing is, when you compare the 1980 CTs and the 2021 CTs, it has changed a lot. The radiation dosage has come down significantly. So then the next thing is PET-CT and radio diagnosis. Of course, I have already mentioned it's a gray area where we tend to have a close association with the nuclear medicine department as well. The PET portion of the report is generally reported by them, and the CT portion, morphological assessment, is done by us. So we both have equal importance. But the study is done in the nuclear medicine department due to radiation safety and other issues. So it is part of radio diagnosis only, but it is done in the nuclear medicine department. So in our hospital, we do have a joint team effort. Then I already have answered this question: is the radiology just diagnosis? No, it is not at all just diagnosis. We have a lot of involvement in therapeutics recently. You can think of this guided interventions and other procedures like DART, TACE, and all. So what we do is we use ultrasound guided or CT guided or even DSA guided procedures for targeted injections of radiotherapeutic nucleotides or even the chemotherapy drugs. So radiology has now evolved so much from being just diagnostic specialty to a therapeutic modality as well. Whole body imaging. So generally people ask just like that, we want to image whole body, we want to rule out cancer. Is there a whole body imaging technique in radiology department? Yes, there are different methods of whole body imaging. It all depends upon your perspective of the clinician. So if you want a patient with osteoporosis being evaluated, you can do a bone scan, or you can do a skeletal survey. Or if you have a patient with multiple myeloma, again skeletal survey, bone scan, and all those modalities are very useful in determining the extent of the lesion. And if you are talking about ruling out malignancies, we do have a modern MRI machine technique called whole body diffusion, which can be done very fast. It is basically something like a stitch imaging, where you use multiple sections in one plane, and you can actually look for a focus where there is abnormal restricted diffusion. Please see my old MRI lectures to understand about what is restricted diffusion and all. See the brain MRI lecture, and that is one modal way of doing whole body imaging. But generally, when a oncologist writes about whole body imaging, he'll be referring to nuclear medicine as scintigraphy. And now recent times, PET-CT is far better than scintigraphy, even better than SPECT, in terms of morphological assessment of the lesion as well as physiological assessment. So whole body imaging is not at all required in a general checkup setup, because if you want to image a whole body using CT, you are being exposed to significant amount of radiation. Especially younger age people should avoid getting that done unless otherwise it is required by your clinician. So as a in general concept, you shouldn't undergo a whole body imaging unless your clinician asks you to do so. So this is for the undergraduates who are looking at for a career in radiology. So there are different steps in pursuing a career in radiology. You can either pick after your higher secondary schooling, you can do MBBS and then proceed in India. If you are studying your higher secondary schooling in India or abroad, also you can apply. You can do your MBBS after writing the NEET exam, and once you finish your MBBS after 5 years, you can appear for the next exam. That is a future of post-graduation selection in the upcoming 2023 and 2024. So MD, DNB courses you can select depending upon your rank. So beware that radiology is a specialty which always gets filled up within the first 1% of the ranks. So that means radiology will be filled up almost in the initial few ranks unless the top rankers decided to go with other options. So then you become, after 3 years of the course, MD-DNB course, you became a specialist doctor in radiology. Previously, multiple universities used to have DMRDs, but recently I have seen very less number of DMRD candidates coming out. This is mainly because of the increase in number of MD and DNB seats all over India. So go ahead and select a college of your own preference. You can do the MBBS and DNB. Post your MBBS, you can do the MD, DNB and become a specialist doctor in radiology in 3 years after passing the exam. So regarding the exam pattern, earlier different universities used to have a first year exam, university exam pattern. Now they have discarded it, or there is now is only one exam in the final year, and you do have internal assessment in some universities, which is very important. You have an internal assessment in our university. Depending upon the logbook preparation, they will give a mark up to 60. So basically that's 1 mark you will score at the end. So that is for a doctor. So what if you don't want to become an MBBS doctor? What are the other options in radiology? So you can either choose a technical side or a management side. So the technical side is basically a person who do a BSc or a diploma in radiation imaging technology or nuclear medicine. So it is called BSc RIT and BSc nuclear medicine. There are diplomas as well. So once you finish that course, usually these BSc courses are 3-year courses. Once you are finishing the course, you can work as technician or radiographer. There are other career opportunities as well. If you do a BSc in biomedical research, or you are a biomedical engineer in engineering degree, you can also work as a engineering support team for various radiological equipments. That is a much lucrative field in radiology than being a radiologist or a radiographer. But all jobs have its own merits and demerits. So it's all up to you guys. So diplomas, I've already discussed this. So now comes the final question, like what do you want to do after getting your radiology degree? So that is the question. So if you are an Indian graduate who had an MBBS from India and who had also finished his MD from India, the options of going out becomes very much limited, because you will be forced to write exams outside India. So basically how do you bypass these exams? Because most of these exams are Western oriented type exams. Some have practical aspects which is very difficult for Indian candidates to clear. For example, there is FRCR, RANGZAR and similar exams. FRCR is for UK, RANGZAR is for Australia, New Zealand and all. For these exams, even for you guys to appear, sometimes you need to have 2 years of clinical experience in relevant field in respective countries. So this is a huge problem when you consider already you have finished 3 years in proper clinical training in radiology. So after that again you are forced to write another qualifying exams. So if your objective is to move outside India or not to work in India, so after doing your MBBS, write PLAB or USMLE, do language courses in some places like Germany and other places in European Union. You need a certain level of proficiency in local language, say C1, C2, C3, and you can move abroad. And there you can actually undergo various training in internal medicine. So remember, it's only in India you can do a direct MD in radiology. In other parts of the world, MD radiology is considered as a super specialty, where you have to undergo an internal medicine or similar MD degree in other specialty for 3 years, and after that you will undergo 2 years of radiology course training, and you have to write the licensing exam to achieve it. So that's why that's one of the huge differences. That means you can get an MD degree in total of 8 years in India, which will take roughly 10 to 12 years in US. But given the time you spend for preparing for NEET and NEXT and all those exams, NEXT is compulsory. I'm also telling you about the exams you have to prepare for a good score in exams. You can use the same or a little bit lesser effort to clear off this PLAB and USMLE tests and go abroad and settle there. And finally, I like to add one thing, that is, remember, the job is very lucrative, but the path is very tough, and it needs a lot of perseverance, be it being a doctor or a radiographer. It is a very tough, one of the toughest branches of medicine. So many things to read and learn, and so many, like practicing also, it is very difficult, but it has so many branching offs which you can subspecialize. So that's all, guys. Thank you. Hope you all had a wonderful time with me. So do follow the channel if you like it. Do subscribe. Press the bell icon. Don't forget to press the bell icon. And I will stay updated on my Instagram as well. So if you are interested in watching me on Instagram, you can scan the QR code. So this is it. Thank you, guys.